Hi, everybody. Welcome to New Frontiers in Functional Medicine, where we are interviewing the best minds in functional medicine. And of course, today is no exception. I am thrilled to be here with a amazing scientist doing up to cool disruptive work. We're going to dive into who she is and what she's about. And let me just give you her bio right now. Her name is Dr. Carolina Reis Oliveira, and she is a PhD, co-founder and CEO of OneSkin. Her PhD is in immunology from the Federal University of Minas Gerais in collaboration with Rutgers University, and is an alumnus of IndieBio, the world's leading biotech accelerator. In 2016, Carolina relocated to Silicon Valley from Latin America to co-found OneSkin and to lead the development of the company's disruptive longevity technologies. Carolina, welcome to New Frontiers.
Thank you so much, Dr. Carey. It's such a pleasure to be here today.
You know, I've been a fan of you guys when I stumbled across the fact that you developed a skin biological age clock. I was so excited about it. And now you bought this because you were just really doing some cool work around anti-aging topicals. And I want that, I want to know that. And I just want to know your whole journey. So give me your origin story, and let's just talk about some of the fabulous background work to begin with.
Yes. So a little bit of my background. I have a PhD in stem cell biology and tissue engineering. And back in 2016, I joined with 3 other colleagues from my lab. And we want to make that translation from academia to the market and really use our science to help move humanity forward. And one of the main opportunities that we saw is that based on our ability to grow human tissues in the lab, so we could replicate skin. And we thought that we could use that skin that we grow in the lab to test anti-aging products that are out there in the market to really measure if they are promoting any rejuvenation or age reversal effect. So since we could, grow these tissues, we thought, okay, if we can measure the age of that skin in the lab, then we can, apply a product and then we can measure if a product's changing what we call the biological age of the skin. So that's when we decided to build a specific skin clock, a clock that would measure skin biological age in a very accurate way, because as you know, nowadays, how companies measure their products' efficacy, it's mainly through customers subjective perception, right? Which is not accurate at all. So if there is a way that we can quantify this age reversal effect, and it's, and in this case of measuring biological age is through the DNA of the skin. So we know that, our skin and all of our tissues, we accumulate change in our DNA as we grow older, mostly on the epigenetic level. And what this clock does is basically measuring those changes that accumulate over time. So
how big is it? Just out of curiosity, how many CPGs in your clock?
So we use the Epic chip from Illumina. So it's more than 850,000 probes. And then the clock itself, it's nailed down to fewer, not 2,000 and something probes.
Okay.
But we are trying as much as possible to reduce, to make it more accessible, to commercialize it. So right now it's still very expensive. We use it mainly for research, but to build the clock, we actually analyze all the 850,000 probes.
That's so cool. Okay, so it's down to around 1,000. I mean, I'm so sorry. I want you to continue with your study, but let me with your story. But just have to ask you one question around that. If you consider commercializing the skin clock, how would you do that? Would you be offering it to other industry folks working on products for skin? Would you be offering it to the consumer? Would I be able to test my skin age?
Yeah, I think ideally would be able to offer to the consumer, because the consumer
Yeah.
first want to know, like, where is the status of your skin age? Like, it's
Yeah.
close to your chronological age, and like it's younger, it's older. So that's like the first, point, like to know your baseline. And then after that, like people are still unsure in terms of product's efficacy. So that's a clinical study that we are actually running right now. Interesting enough that we are following the participants over a course of like 6 months up to a year, using our products topically. And then we are measuring the change in the biological age to validate that our product is actually reversing the skin age. One caveat of this process is still that we need a biopsy.
You do?
So
Okay.
yeah, so it's still invasive, it's still a little tricky in terms of, logistics, how you partner with a dermatologist or, a clinic that to collect the biopsy to send to us. And then the other piece that is still a little prohibitive is the cost that like, I would say that our cost to generate the data is about like $1,000. So even to commercialize is going to be still a little expensive. And that's why we're looking to reduce the number of probes that we are analyzing, so we can, reduce the cost and make it more available to consumers.
Yeah, I understand that. I mean, when we did ran our study in 2018, 2019, the arrays were at least 1,200. I mean, and the prices, the price is coming down. Do you think that you'd be able to get a reliable measurement using a non-invasive specimen, or biopsy just strikes me as obviously optimal?
Yeah, we are working in collaboration with another company to test if like tape strips could collect enough biological samples.
Awesome. Yeah.
And if we have enough biological samples, if that measurement correlates with the data that we get from biopsy. So in these clinical studies that we are running, we're actually doing both. And hopefully we'll find a way to, eliminate the biopsies.
I'm just thrilled though with what you're doing, the investment, the financial investment, the science investment, because I mean, research in this space has been dismal. It's an embarrassment, and products, and products are incredibly expensive. I mean, it's mind blowing that the industry has gotten away with it for so long. So the fact that you're getting in there with like real science, with actual biopsies, that you've developed a biological age clock specifically for the skin and you're testing it. And I know you started in vitro and now you're doing clinical trials, and we'll talk about all of that. But I want to say that I love what you're doing, and I'm so happy to support, elevating your work. So thank you.
Yeah, no, I appreciate it. And it's interesting because we, as I was sharing, like we didn't start out to create a product or a brand. Our goal was initially, again, to measure the efficacy of these products that were out there in the market. And then when we realized that, okay, there are many anti-aging products out there, but none of them were developed with like the rationale of like targeting aging in the first place. Yeah. And so most of the products that are out there, they are, treating the surface of your skin, and, sometimes they make your skin, look better, but there is no focus of like attacking or no, what's the root cause of aging, in the deeper layers of the skin. And then in the end, like you can have like temporary results, your skin can look better, but it's not like biologically younger. So on the other hand, what we saw is that this new area of like longevity and age reversal was evolving so much like in the past few years, and we now understand what are the main drivers of aging. And we saw a very clear opportunity for us to develop a product that was addressing the root mechanisms of aging, and that was going to promote a more significant age reversal effect. And in the end, we set ourselves to, find new molecules that were actually gonna, reverse aging. So that's why we're a longevity company. And once we found a molecule, okay, we decided to create a product out of that molecule. So it was kind of a consequence of our research and of this goal of actually, you know, studying aging first, understanding how aging works, and then looking for interventions that were actually targeting the root cause of aging.
So fascinating. So you guys were or you ladies, you women, I know you're a woman scientist company, which of course I love. Just another reason to support you guys knocking it out of the park. But so you were coming from being stem cell biologists, you were able to actually create an in vitro skin model that you could test, and then you developed the clock, which is incredible. And then you started to test products, and we know the dismal selection of products. And I just want to say that you guys, you actually found that plenty of these products accelerated aging. Maybe at best, perhaps there was no change, but a lot of these things that were slathering on our skin were actually accelerating aging. And I just, want to point out from a functional medicine perspective, where we're all reading labels, we certainly see that many chemicals we're putting in our bodies, are toxic.
Yeah.
And it's interesting that you found it. So I want to just link back. So you started all of this research and you're like, oh my God, these things are horrible. And then you decided that you were going to go into investigating the way that you could actually disrupt the aging process happening, looking at the hallmarks of aging and figuring it out. Okay, so speak to that and then get us back in the story and how you found your peptide.
So this was, I mean, a surprise in some ways, but not a surprise in other ways. As you mentioned, like we know that if there are toxic ingredients there, that definitely is like damaging our skin, but sometimes it's hard for us to see at a naked eye, right? Sometimes you're gonna get like a rash or you're gonna get some kind of irritation. But when you grow the skins and then you apply a product that's not clean or safe, that has like toxic ingredients, the skin will start to degenerate. Like the cells that were like supposed to have a certain morphology, they start really to become like really weird. And it's so clear and reproducible, the products that are actually bad. And it's funny because we initially used some best-selling anti-aging as a positive control. Let's see how they perform so we can, find something that performs better than them. And then we realized that they were the negative control because they were consistently, causing a lot of damage to the skin. And other products that are really used in this market, for example, retinol and retinoic acid.
Yes.
We can also reproduce what they make our skin to do, like this peeling effect that the upper layers are, coming out. And the retinol is interesting because for a certain period, we'll elevate like markers of inflammation, aging, and we'll also increase collagen, some other like important markers for your skin. But the learning that we had with retinol is that if you overuse retinol and you cause like too much of this cell renewal, you are exhausting your tissue and you are inducing so much inflammation that in the long term is also not good for your skin. So there is a very, fine balance of how to use retinol in a way that you harness its best, results. But then what we realize is that, okay, right now, most of these products that are considered effective, they are only promoting good results by harming your skin, right? Like that's what retinol does. Is there a way that we can actually harness our biology, that we can promote this rejuvenation effect without causing the harm, without causing the inflammation? And when we started to understand about aging, and we saw that one of the main, drivers of aging was the accumulation of those aged, zombie cells.
Yes.
We thought, okay, if we can find a way to decrease the number of those aged cells in the skin, we may be able to selectively, remove them and then allow the healthy and young cells to proliferate. And then we are rejuvenating the skin in a very safe way, without disturbing the good cells. And then you end up with a very similar results that you get, or better, with retinol without the side effects.
So let me ask you just a couple of questions before you move forward in what you have discovered to do this. I'm curious if any toxins were a standout to you in really, disrupting this in vitro skin model that you were using. Were there any particular toxic players that come to mind?
I needed to go back and analyze the ingredients list and my team, I have a chemist that she's the one that know exactly all the ingredients that are very bad. But for us, again, when we see that, and you can use some websites that help you to rank the ingredients, for example, EWG, right?
Yes.
And when you put the product name, and depending on the score, it really matches with the results that we're seeing.
Fascinating. Oh my God, that's so interesting. Okay, well, if your chemist can shoot us any, we'll put them on the show notes, you guys. We'll follow through with it and see if we can get some of them. Also, I want to let everybody know too that we'll link to the website, to OneSkin website, where they have a clearinghouse of all the studies that they've published. So any super geeky people, you're interested in that original skin clock that they developed, we'll make sure that you have access to all of those. Let me just ask you one more question about retinol, because it's sort of like the anti-aging, workhorse compound. Would you just, you look to mimic retinol. So you would just, I'm going to guess that you would probably say, don't use it, because the therapeutic window is probably very narrow and you can hit damage if you go too far in either direction. I know some people put really, really concentrated amounts of retinol on their face, and then instead you found that your product can mimic the benefits of retinol. Would you say that you should just avoid it? What are your thoughts there?
I'm not 100% against. I think there is a way that you can even use retinol in combination with other products that can counteract their side effects. So I think my main recommendation is not overuse, or not induce too much inflammation for long periods. So I think if you give your skin time to, because we will peel off your skin, you induce that cell renewal, you'll build more collagen. If you give your skin time to recover and, reduce those levels of, irritation or inflammation, you can definitely, get some benefits of it. So I need more research to actually say, don't use it at all. There is something that's, because the mechanism of action is different, so the way that our peptide works completely different from, in the end, aging, there is not only one way to target aging. And, there is definitely, you need to, attack this process from multiple angles. So
let me just say that I personally, I don't know. I don't know that there's a place. I experimented a little bit with retinols in my life, and I don't know. Listening to what you're saying about it, it seems like the risk isn't worth it. The risk benefit, especially where we are. So let's talk about you. Let's talk about this amazing peptide and how you discovered it, and thinking about the hallmarks of aging and what you're addressing with it.
Yeah, so as I was saying, we were studying, the aging process and what are the main hallmarks of aging that we could intervene, that could promote this rejuvenation effect. And we got really interested in senescent cells, or the zombie cells. So for those who are not familiar, senescent cells are cells that are already in their, end of the life cycle. They have accumulated a lot of damage, so they stop dividing, because if they continue to divide, they could become a tumor. But they also, on the flip side, they start secreting inflammatory signals that basically function like a bad apple in a basket. So one senescent cells spoils the good cells around to age faster. And back in 2016, we saw the community really interested in ways to eliminate specifically senescent cells. So there is a lot of research in the longevity space focusing on molecules, on, peptides that could eliminate them. So we decided to search for new peptides, and we chose peptides because it's a biological molecule. It's already used in, skincare products, and it tends to be safer. And we tested over 1,000 different peptides in order to find the one that was able to decrease senescent cells to a very minimal level that was not causing that damage anymore, and was also safe, and that was also able to penetrate the skin. So after a few years of research, we found this peptide called OS1, and we could show that when we treat aged skins with the OS1, we can decrease the levels of those aged cells up to 30 to 50%, depending on the model. And then in turn, what we see is that the healthy cells can proliferate again, and they start producing more collagen again. And this results, in a healthier, more functional, and a younger looking skin. So it's very interesting because, again, when you understand, okay, if this is the cause, if we have fewer of those cells, your organism knows what to do. So you let your organism kind of, to go back to that, healthy, functional state. And this hypothesis, was proven right when we, did the studies in vitro, and then later on, in vivo with humans.
What kind of bioage reversal did you see in the in vitro model using OS1?
Yeah, great question. So in vitro, the conditions are completely different. It's a totally isolated system. When we applied the peptide in the conditioned media, so basically the media that is in contact with the skin, so there is I would say a higher delivery rate. We saw a reversal of around 2.6 years during 5 days of treatment.
Wow.
So very short, I know. But that's why now we are running these clinical studies. And when we finally have the peptide in a cream, and obviously, when you have the peptide in a cream, not all of the peptide that's in that cream will penetrate the skin. So you need obviously, many applications and longer periods to see this data or this result. And we have run this experiment from 6 months up to a year. At the end of 12 months, we saw a reversal of 3.3 years. But this was a smaller cohort, was only 11 participants. So we are now increasing the cohort to see if we can show this significant reversal effect within 6 months. So we're just starting again a new study. But again, it's super cool that we can already show in humans that we can reverse your skin biological age with a topical treatment. And
that's very cool.
Yeah. And you can measure it. And again.
And this is the product. This is the OneSkin product. So it's not some special research formulation that we don't have access to.
That's the product that is actually available in the market. We did with our main, products. That's the OS1 face. And that's the one that we have, more studies because it was the first one that we brought to the market.
You showed, well, actually, I want to, in your clinical studies, you looked at more than biological agents. So I want to talk about some of the more classic measurements that you reversed. But before we do that, so the OS1 peptide is able to sort of quench senescent cells. Maybe this is beyond the scope of our conversation, but I'm just curious mechanistically what's going on there. Maybe
I love this question. Actually, I love our customers and our community because they always bring the same question. Okay, how it works and what this peptide does with the senescent cells. And we actually did a pretty, I would say, deep study to actually understand how it works, because there is the classic way that a molecule can, induce the senescent cells to die, to enter in apoptosis. And there is another way that the peptide or whatever, xenotherapeutic can act. That's like by suppressing the release of those inflammatory signals. And our peptide works by this way. So that the presence of the senescent cell itself, it's not a problem, but it is their secretion that's causing the damage in the surrounding cells. So what our peptide does, basically, it suppresses the senescent cells to release those bad signals to the cells around. And with that, we can recover again the homeostasis of the skin, and some of the senescent cells that were already present will enter in autophagy. So in the end, you don't, induce the formation of newer senescent cells, and you also reduce the number of the senescent cells that were already present in the tissue.
Incredible. Like it's just it's like a pleiotropic anti-inflammatory compound.
Yeah, exactly. And peptides are known to be more pleiotropic. They basically can bind, different receptors, but the end result was, in terms of like, cytokines released, we can see that decrease a lot the levels of inflammatory cytokines. And with that, you allow the healthy cells to proliferate and produce more collagen, hyaluronic acid, and improve the skin barrier function. So it's very, very interesting.
Very interesting, and it begs the question. Not that I want to stay on the skin focus, but would we use this internally, this peptide? Is that something in your future?
That's another great question. And people say, can I drink my cream? Yeah, we have some studies in C. elegans. So C. elegans is a very known model to study aging. And basically what we saw when, we fed these worms that live, very shortly, around like 20 to 30 days with our peptide, we saw that we increased their lifespan around like 16 to 20%. So it does have a potential of really, extending lifespan. Obviously, for humans, we needed to go to, preclinical studies and eventually, clinical studies. So we have several collaborations, on this side going on to test this peptide in different, conditions. And I think our ultimate goal to have like, can we use this peptide either orally or intravenous and basically help our bodies to clean up those, bad cells so our bodies can perform well for longer. But this will take, a few years still.
Very interesting.
To be validated.
Wow. So it's a topical senolytic therapeutic. That's so cool. And maybe one day it'll be an internal.
Yeah, for sure.
All right, let's talk a little bit about then what else the product does. So like, I'm sorry, in your clinical studies, you guys gathered a bunch of classical measurements on barrier and elasticity, et cetera, et cetera. So tell me about those.
Yeah, definitely. So obviously in the end, people want to know like how targeting senescent cells will impact like their skin health and appearance. So we ran like the classical clinical study that participants use the product for like 6 weeks and up to 12 weeks. And we could see measure significant improvements after 6 weeks on hydration, on firmness, elasticity, and fine lines and wrinkles. We have like almost like 90% of the users like showing improvement in fine lines and wrinkles. I would say that for fine lines and wrinkles, this can take up to 12 weeks because obviously the way that the peptide works is by penetrating the skin, basically, working from the inside out, right? Changing a little bit of the makeup of the skin on the dermal layer, and the dermal layer is the layer that will, produce more collagen that will lead to that, firmness. and better appearance. But another great result that we saw was the improvement in the skin barrier. And as you know, like skin barrier, our skin, is designed to be a barrier for a reason, right? We want to protect our internal body against like pathogens and, several stressors. And when the barrier is compromised, like we have several like skin disorders, we have like eczema, we have like several inflammatory diseases. And maintaining the skin barrier is a way to show that your skin is functioning properly. So, and it's also important to maintain our overall health, right? That's another area that we are super interested in, connecting your skin with your overall health.
I just want to underline how important that is, improvement in the skin barrier. So, I mean, I know I'm on faculty at the Institute for Functional Medicine in the immune module, and I specifically talk about skin barrier, as it relates to eczema, but in general, like once the barrier is compromised, not just pathogens, but allergens. I mean, an infant can become sensitized to peanuts through the skin. I mean, it's that if through a compromised barrier, but also UV, also environmental toxins. So a compromised barrier is going to promote the production of senescent cells, and it's going to drive the inflammation forward. So the fact that you've significantly corrected that is, I mean, I think it's essential to the success of the product.
Yeah, and actually it was our primary goal. I think, as a longevity company, we are mainly focused on like improving the health of your skin. And we believe in that, a healthy skin is a better looking skin. So, the aesthetic benefits, they are a consequence of like, really fixing the underlying cause of, unhealthy skin or aging skin, that there is nothing problem with like aging itself, but we know that with aging comes all of those impacts in our health and the function of our tissues, and that's what we are trying to counteract.
It's awesome that we're moving beyond just this obsession with the aesthetics alone at any cost. Even as they accelerate the aging journey, it's like it's just time to move well beyond that.
And I think it's very good to see that consumers are getting more and more like educated and pro these alternatives that are both like good for your health and also good for your aesthetics, but never like that's what we are pro, like never compromise your health in pro of like getting a flawless skin, because in the end, like what is the point if internally you are not healthy, and that won't last long.
Yeah, absolutely. So moisture was improved, and you conducted the study in winter, which is really cool, because that's
exactly.
something that
that's
doesn't
a very
happen.
good point. There are so many variants, and we could still see improvement in hydration and the skin barrier, as we said, like we measure through an instrument, so it's it's quantifiable. And another area was like tone, because with obviously aging, everyone experiences more like dark spots and sunspots, and the product helps like controlling that melanin production that also gets like deregulated with like the presence of senescent cells.
I think the cool thing about one of the studies that you did was that you compared the base ingredients, which are smart. You have a smart design of base compared to the full product with the OS1 peptide. And you showed some benefits on both sides, but obviously the OS1 peptide formulation, well outperformed it. What are some of the other key ingredients that you think make the product perform as a whole along with the OS01?
Yeah, we have several important supporting ingredients. Some oils from like that we brought, from the Amazon rainforest. So
cool.
We have palmolado oil, prakashi oil, and they are very anti-inflammatory and like rich in antioxidants. very calming and soothing for your skin as well. So as I said, like people that sometimes have like eczema or some kind of, rashes, they see an improvement, they see a calming in their skin. And then we have niacinamide, that's kind of classic. Allantoin, it's very calming and soothing as well. Vitamin E. I think these are and hyaluronic acid. We have like 3 different molecular weights of hyaluronic acid. One that is a very large molecular weight that's gonna just form like a barrier on top of your skin and like retain moisture.
Okay.
And some, low molecular weight that can actually penetrate in the skin and activate your skin to produce more hyaluronic acid.
Which is kind of like the classic, I think of it as a sandwich. So you have an occlusive that keeps things in, and then you also have a humectant that gets in there. Fabulous. There's studies happening trying to figure out barrier repair products to, inhibit the allergic march. Eczema to asthma, to food allergies, et cetera. And there hasn't been success. I guess I can't help but wonder how yours might perform with this evidence that it can improve barrier. Yeah, you have some thoughts?
Yeah, that's a very interesting point, because I think as you mentioned, like when you want to improve the barrier, it can't be only like on the surface, right? We need something that will be more active. So our actives like the peptides and, the hyaluronic acid that can penetrate the skin, that will work from the inside out and help your skin to actually repair the skin barrier, more so than creating like a physical barrier just with, those emollients. That's what, in the long term will help your skin to recover from some of those, distress that the skin is experiencing.
It'd be interesting to see. I know the research they were looking at was exclusively in ceramide products, and I think there is a place for ceramides for sure, but the outcomes weren't very exciting.
Yeah, and by the way, we have another interesting study, and we can talk. So basically, we are focused about skin health as a whole. So that's why we have a face and a body product. And one of our hypotheses and aim with our companies that we need to show that your skin health impacts your overall health, as a whole. So as you age and you start accumulating more senescent cells and you start to get your, skin barrier compromised, you also have more like release of inflammatory signals that coming from your skin. And because your skin is your largest organ, can actually impact your levels of inflammation systemically. So our hypothesis is that if we treat our skin topically and if we're able to repair the skin barrier and reduce the levels of inflammation coming from senescent cells, can we help lowering our inflammation, in the blood systemically? So we are, running this study in which we collect blood before the patients start using the product, topically, and after 3 months, we collect blood again to measure the impact of a topical treatment in your circulating inflammatory levels. And I think this is totally correlated with the skin barrier, and definitely a very interesting way to show that your skin is much more than we think, right? It's just not a barrier, but it's like an organ that's actually super connected with our internal body.
Huge. That's so interesting. So is that study underway right now? Do you have anything okay. So you can't report on it.
Yeah, we should end now, end of like June. So we hope to have but the preliminary, because some participants already finished and we already see some very interesting trends in decreasing some key inflammatory cytokines upon the treatment.
Can you share any of them yet? I'm so curious to see what you've changed or to hear what you've changed.
I think I'll hold just because things can change when you have the whole.
Fair, totally fair. You definitely.
We can do a second episode.
We can do a second. Yeah. When that paper, you have a couple of papers coming out that we should talk about, and anything that comes out, we can link to on the show notes, folks. We We will. We'll make sure that you're
Yeah.
in the know with this cool product line. So you alluded to people using this for eczema. I mean, obviously, as a clinician, and there's a lot of doctors and clinicians who are listening to this podcast. So not only are they thinking about using it for themselves, but they're going to be thinking about prescribing it to their patients. Have you looked at using OneSkin for eczema or for other skin conditions?
Yeah, not on a clinical study. So all the data that we have is still anecdotal.
Okay.
But I think, yeah, we definitely need like results or studies to prove like this hypothesis. I think the whole rationale behind like improving the skin barrier makes sense.
Yes.
But obviously eczema has more, it's a more of a complex like, condition. So there will be other, factors that could interfere as well. Another thing that I think we saw that was interesting, mainly from, the body product, and a lot of people, during the aging process, they experience a lot of itching and flakiness, and skin gets really fragile, tends to tear really easily. So we did see a lot of improvement in terms of improving the skin resilience, and decreasing like itchiness, and so the skin is recovered to that health and kind of I would say strong state again. So that
very impressive.
Helped a lot, many patient participants as well.
I mean, I can say that certainly the variables that you're measuring, barrier, the hydration status, these are all the classic measurements that they use in products designed specifically to treat eczema or atopic dermatitis. So it seems to me that, I'll make the leap that it would be absolutely reasonable to try. And it's very gentle.
It's very gentle. We even like if you had like a child that has a problem, like we haven't tested, so we don't publicly recommend, but I would say that's safe for a child though, or
okay, that's just really exciting. All right, we've covered a lot. Let me think. Oh, the other question I wanted to ask you was, we're thinking about the skin microbiome a lot and the influence on either accelerated aging or decelerated aging. So again, coming from a background of thinking about allergic disease and atopic dermatitis, there's always a dysbiotic microbiome that's involved in the process. And I'm curious if you've looked at changes to the microbiome with OneSkin.
Yeah, that's a great question again, and we actually have a clinical study ongoing as well to measure change in the skin microbiome after people are using the product, because it's really hard to mimic the microbiome in vitro. So that's something that we cannot assess with our tools in the lab. But we are also curious, and there are many studies showing that your microbiome changes with the aging process, and obviously, when you are experiencing any of those conditions. So we want to understand a little bit more of the impact of our product after a certain period. So I'll add this.
Keep me posted. Yeah. Well, actually, I have to say that, paying attention to that literature for a while, and correct me if I'm wrong, but my conclusion was that it's more, if we correct the imbalance in the skin, sort of the underlying imbalance, and the microbiome tends to follow. So going in after a imbalanced microbiome with some sort of antimicrobial, or trying to sort of eradicate and rebuild is probably not the approach. It may be the inside out rebuilding of the skin itself that may change it. And your study would actually confirm that, or refute it.
I think it as always is kind of a two-way approach. I think it's a little harder to actually add the right amount of microbes to your skin that you need with a topical product. There are like so many variables, and that it's hard to guarantee the delivery of like the right ones to your skin. So I would agree with you that when your skin in a, you know, in a good like homeostasis state, that the direct consequences that your microbiome will respond and will, because you know the default when we are healthy and young is that, you know, everything is kind of, you know, in harmony. So that's a consequence of like having a healthy skin, is that your microbiome would like complement that.
Yeah. It's a
Underlying.
synergistic, like symbiotic relation, but beneficial relationship. Well, we've covered a lot. I'm really, really, really excited to get to talk to you, and I look forward to other conversations as you are so committed in moving the science forward. You know, I just hope you blow this field right up. It needs it. Anything else that you want to add? And we've covered quite a bit. I'm thrilled about the clock. I'm thrilled about all the papers. Every question that I had, you know, you're already researching it. So what else?
Yeah, I mean, maybe just touch on, you know, what we are developing next.
Yeah, good.
Yeah, that's also super interesting. And as we think of like the impact of senescent cells in other, you know, conditions, I think another one that's really close to what we are doing is hair loss. As you know, it's associated with aging. Your scalp is a continuation of your skin, and there are several studies actually showing that senescent cells impact, you know, in hair loss and even like in graying hair. So I think it's so fascinating when you think that, okay, if we can actually target aging at the root cause, we can solve so many things that we are experiencing, and, you know, with like one kind of, you know, same you know, target. So we have just started like researching hair follicle growth and, you know, the impact of senescent cells, and testing our peptide in combination with other ingredients to evaluate whether we could also treat or prevent hair loss as well.
Wow. Anything to report? Is this where?
Yeah, no, it's still early. It's still early.
Okay. That's very exciting.
So yeah, this one is probably going to take a while. Yeah, I think that the other closest, you know, product that we are bringing to the market will be like a sunscreen that also has the peptide. So I think obviously we know that, you know, sunscreen is the best defense against aging. You need to choose well. You know, also sunscreen, they can be sometimes a little toxic in some ways, so choose mineral ones. But I think combining a sunscreen with our peptide is basically having like a two-way defense against, you know, sun damage, because sometimes when the sunscreen, you know, cannot be effective and you accumulate sun damage, then the peptide has this ability to repair or to help your cells to repair, you know, the damage more efficiently. So it will be like, you know, a duo that will, you know, work super well to, again, continue to promote the skin health.
Perfect. Well, keep us posted on that. Really exciting, all of it. All right, Carolina, thanks again for joining me on New Frontiers. Folks, again, you will find all of the information we covered in the show notes, the links to the papers, etc. So thank you.
Thank you, Dr. Kara. So fun, this conversation.
Good.